Hi, my name is Seth. I'm a second year nursing student here at McMaster, and today I'm going to be performing a catheterization. The reason why we perform catheterization is to alleviate pressure from the bladder area and to remove urine from the patient. Before I start this process, I'm going to check my patient's name and date of birth with their wristband to ensure that it is the right patient I will be performing the catheterization on. And then I'm going to start with basic hand hygiene. So while I'm doing this, I'm just going to make sure my hands are completely covered, clean, no visible soils whatsoever. And then I'm going to open up my bag. All the while, my bed is already placed at a 10 degrees elevation, and the bed is at the right height for me to work. And now I'm going to begin by opening my sterile field. I'm going to make sure I'm only touching the edges and not reaching over to ensure I'm not contaminating the field. Once that is open, I see I have my tweezers here. I'm going to grab those. And with my tweezers, I'm going to grab the paper here and let it open. I'm going to make sure that the shiny side is down. I can grab the outer 1 inch. And I will place it like so. Now I have my sterile gloves. Move those just off to the side here for now. I'm going to grab this blue paper here, and once again with the shiny side down, I'm going to place it over the genital area here just to make sure that everything is covered and to keep the patient covered. And now I'm going to remove all of the objects I need for this process. The cup with the cotton ball swabs, the syringe with our saline fluid here, the test inflate the catheter, the lubrication required, and now I'm going to place these tweezers right here on the edge because I do not need them anymore. So the first thing I'm going to do is I'm going to open up my catheter, and without touching, I'm just going to try and get it open. Alright, so now I'm going to grab my saline solution here, open it, and pour it into the cotton ball swabs here to get it nice and wet. Then now I'm going to take my gloves and I'm going to place them on my hands here, making sure not to touch the outside of the glove with the first one. And I will pull them down as far as I can go, without touching the outsides, alright. And then now I will grab this glove, ensuring not to contaminate the glove. I will only touch the outside edge, outside glove. Now that they are on, I'm going to grab the catheter and I will place it over here in the sterile field where I can test inflate. And now with putting my 10 mils in, I can see that the catheter has fully inflated. I will now let the fluid back out. I can see that this is a 5mm/cc catheter. I'll keep this on actually. And now I'm going to grab my lubrication, open it and place it on the sterile field here. The lubrication helps with the insertion process of the catheter to make it easier. I'll place that here. I'm going to lubricate the catheter. now this is where my hands, one of them will become contaminated. I'm going to grab tweezers here, the wet cotton ball, and I'm going to clean from the inside out to ensure not to contaminate. So now we're going to continue with the catheter insertion process. I'm going to grab the catheter here, and with my one hand I will have to open the vagina to try and find the hole to insert. I'll gently insert, and once you insert a certain distance you should feel a slight resistance to know you're at the end. Once you're far enough in, you can inflate the catheter. And last but not least, you can give it just a little tug just to make sure you're in all the way. There we go. And I can now release that. And that is the steps for inserting the catheter. Now I'm going to have to attach the bag to it so that we can drain all the fluids. So with the catheter bag here, this one hand now is going to be considered sterile. I'm going to attach it to the edge, and I'll grab here. There we go, once it's fit on nicely. And generally when the catheter is inserted, the way you can tell that it's in, you'll begin to see some urine drain out, which is a good thing. So now that it begins to drain into the bag, that is the steps of inserting the catheter. Alrighty, so now we are going to be removing the catheter. So to begin, we are going to insert the syringe into the place here, and we're going to deflate the catheter. You should get 10 mils of solution. Sometimes you have to pull to get assistance on the back here of the syringe just to ensure it all deflates out, but usually it does it all by itself. Now that it's all out here, I can gently place there, or release, like so. And now we're going to remove said catheter. And I will place there. Going to check to make sure that the balloon stayed intact. I could have left the syringe in if I wanted to, but just for the sake I pulled it out. The balloon inflates fully, so now I can tell that the balloon is intact. I'm going to now drain the solution. And now I'm going to take the urine and I would pour that into a cup to measure the amount of urine output that we would have from the patient, and then I would dispose of the rest of this equipment into a biohazardous bag. I will remove my gloves, clean the whole area, as well as perform hand hygiene at the very end. Thank you, and that's the end of this video.